this is a critical issue around access to healthcare services, and that's one of our core issues. We've been involved in the health market inquiry from the very beginning, which is around 2014, when we began engaging with the Competition Commission before the panel was actually implemented. And we were talking about the right of access to healthcare services, as is guaranteed in Section 27 of the Constitution. And our early engagements were around how to have a constitutional view into this private health market. And we understood that this was a technical inquiry conducted by the Competition Commission in terms of competition law. But our argument from the beginning has been that even competition law should be viewed through the lens of the Constitution, because that is our ultimate law, and all laws are bound by the Constitution. So in the last 5 years, and it has been 5 years of this inquiry, there have been many moments where we have been able to engage, and we actually brought a lot of patience into this process. We attended the public hearings that were held by the panel, and we brought some of our clients who we've represented in their struggles to gain access to healthcare services through the private sector, and to tell those stories. We found that that was an essential part of the inquiry, so that even though the actual analysis would be done by very technical people like the accountants and the actuaries and the economists, that there would be a real sense of what it means when you have a failing market, what it means for people in their most vulnerable moments. And I think, one of the early findings of the panel was that patients and users of the health system are disempowered. They lack information, they lack understanding, and there's nowhere to go, actually, to get that knowledge and understanding. And that was one of the critical things that came out at the end that required a solution. I think also one of the key things that we understood from the very beginning was that there was incomplete regulation within the sector and inadequate regulation. And whilst it was never our call to regulate the sector, the call was to ensure that even in a private sector, even in a private market, that the state had obligations. It had primary obligations in terms of Section 27 of the Constitution to enable the advancement of the right of access to healthcare services. And I think it's quite important for us to go back to the National Health Act, which talks about a unified health system. In fact, I wanted to read to you one of the purposes of the National Health Act, which is to unite the various elements of the national health system in a common goal to actively promote and improve the national health system of South Africa. So it's not just about the public health system. And I think part of what the transformative drive of the Constitution says is that we must address inequality wherever it is. Even in markets that are driven by profits, we must consider transformation and addressing inequality. And in our view, the health system as it is now, as it is today, really reflects the inequality in the country. We have a private system that serves a very small percentage in the region of 17, 18% of the population, and the balance are served by the public sector, and yet there are not, adequate resources in the public sector. So whilst there may be an argument around the failings in the public system and the problems of human resources and corruption, there still needs to be a concentrated effort to look at the private health system and to ensure that we are also addressing inequality there, at the same time as addressing inequality in the rest of the system. So for us, we've been thinking about what this means for patients trying to use the health system and trying to access their rights. And we think some of the key things that patients care about are access, firstly, pricing, quality, and information about these various things. And so some of the key recommendations that have come out of the inquiry, out of the panel, that start to address some of those issues include the supply side regulator. And this is a big one, right? And the panel has said that this is one of the early things that should be done. We should start focusing on what this should look like, how it should begin to be built up in the current system, having regard to what's happening in the public sector. And I think what's important about this report is that it doesn't forget that there's a public system and that there's an NHI bill. It's interesting that the report was released at the same time, as you say, as the NHI bill was released. But I think the content of the report constantly had cognizance of the public sector. So the supply side regulator will start to look at licensing issues, at pricing. And I think pricing is going to be an important one. And there's obviously the historical issue around the Competition Commission's finding or ruling back in 2010 that said the doctors could not negotiate prices, couldn't get into a room and talk about prices because that was anti-competitive. I think now we have to move past that and start to think very clearly about how to put together forums. And what is proposed is a multilateral negotiating forum where parties can actually get together, share information, and begin to set prices. And interestingly, the prescribed minimum benefits was one of the key things that we had a keen interest in that because it essentially is the basket of care that people are entitled to within the private health system. However, what we've seen through this report is that this PMB, the way it was implemented, had kind of an adverse incentive to almost change the shape of public health. Where we're starting to see diagnoses that relate to PMBs. We're starting to see treatment. And so you begin to have resources surrounding hospice-centric care and PMBs. So the panel has not said, let's get rid of PMBs. What they've said is that we should have a standardized benefit package. And I think that this is going to be a new kind of PMB, where we're going to have a standard package that all medical schemes will have within their benefit options. And that begins to address the information asymmetry. So you'll be able to actually compare scheme to scheme and benefit option to benefit option. Because one of the key findings was nobody knows. You get told by your employer, you're on the scheme, and you kind of figure out, and then you start saying, oh, next year I'm going to pay less. I'm going to get a less of a package because I'm actually more healthy. And so we're making decisions that have little to do with quality, value for money, and access to services.